Alright, so many of you have sent us comments already. We appreciate that. We are going through over 100 comments received. This is the third of 5 forums. We will also take the thoughts that all of you provide into consideration as we consider all these comments. Again, everything that you see here is in draft, so we haven't formalized any of this, but it gives you an idea of what we're thinking about, and we appreciate your feedback. So with that, Bruce, you want to? I'm not going to go through this. You all know Lieutenant Governor Brown's leadership. The Act was created out of a work group led by Dean Reese and the University of Maryland Medical System. It had about 15 or so academics and practitioners on it who looked at all the research and disparities to come up with a host of ideas about how to address them in the state. Go to the next slide. So the work group came up with the Health Enterprise Zone idea. We have $4 million. We are looking to fund 2 to 4 zones across the state. We heard the Lieutenant Governor talk about how this is a pilot. It's a 4-year pilot. We are hoping then, obviously the legislature, we look to the General Assembly to help us to have $4 million in each of the 4 years. And what the work group focused on when they discussed the creation of the zones was that the initial targets should be chronic diseases, including asthma, diabetes, and hypertension. That's not to exclude other chronic diseases that exist. Infant mortality, every community is different, and as you'll see, communities will be able to come to us and say, yes, asthma is an area where we need support and we can move the needle in our community, but infant mortality is just as big an issue in our community, and that's one of the goals that we would like to address through our proposal. Next slide. So there's 3 components, the Health Enterprise Zone. 2 very important components that I don't want to leave here without imparting is that the Act includes a lot of improvements to cultural competency, making sure that cultural competency is a part of how we deliver health care from here on out. And then finally, the collection of health disparities data. This is as simple as when you walk into the hospital, and I'm sure Marcos can attest to this, asking somebody's ethnicity and understanding the differences between those ethnicities. Next slide. So we wanted to, these are our goals obviously, the Secretary talked about these. One of the things here at the bottom, reduce healthcare costs and hospital admissions and readmissions. We know that it is infinitely more expensive to take care of somebody when they come to the hospital rather than if they had gone to their primary care physician, or better yet, if they had learned about some prevention techniques to keep their diabetes under control. So when we talk about applications, we want to be able to show reductions in admissions and readmissions because those are savings to the system. Next slide. So each HEZ will be a contiguous geographic area. We have specified that they illustrate poor health disparities and health outcomes. We want these areas to be small enough to allow for the incentives that the Lieutenant Governor talked about to have an impact, but large enough to track the data. So we know, for example, that I'll use Baltimore City as an example. In Baltimore City, one zip code has many communities of more than 5,000 people. So we understand that an application may come in that doesn't address the entire zip code. It may address a community within that zip code. But for the initial mapping that we did based on this data that we record, we did have to stick to the zip codes because that is kind of the fairest playing field across the entire state. And we'll get into, and some of your comments have illustrated to us how we might want to think about the designations to make sure that your zip code is the initial screen, but that there's screens behind that where you can show that there is need. Applicants, we're looking for nonprofit, community-based organizations. Also, local health departments are eligible to apply. We know, for example, in a county like Montgomery, that there is a robust nonprofit community who has lots of experience writing large grant applications for millions of dollars. That's not the case in some of our more rural counties, and so the ability for the local health department to be the applicant helps that community submit an application that really encompasses all of the criteria that we're looking for. All right, let's go to the next slide. So what are we looking for? The Lieutenant Governor also mentioned the incentives. Incentives are part of the program, the other part being dollars for general public health. Say you want to hire additional public health nurses to go out and knock on doors. That is could be an equal part of an application. But for those areas where you are receiving incentives, such as loan assistance or payment, the law needed to articulate who would be eligible for those incentives, and you see that listed out here. Next slide. So our timeline, right now, public comment. Our official public comment period ended last Friday, so thank you for everybody who wrote in. We're doing the forums as well, also another form of collecting input. The process now is that we owe the General Assembly a report that articulates how we went out to the community. It didn't say you had to do X number of forums. We got to create whatever that process was. The General Assembly will review the report and then give us the green light to go ahead and start drafting the RFP, RFQ, which we anticipate being able to have up by the end of September. That will give groups hopefully around 6 weeks to get their applications together once they're seeing the final criteria. So that brings us to the end of October, early November, and then we will review them. The Community Health Resources Commission, which Dr. Lee is a part of, is a grant giving organization that has a lot of experience in overseeing grants, and that is why the law specifies that they be the one kind of as a third party to review all the grants. Now the secretary receives the grants, the commission makes the recommendations for which zones to select back to the secretary, and he makes the final call, and that is all in the legislation. To the next slide. So again, we requested feedback on the eligibility criteria, the principles of the zone, and the benefits. So if you have additional thoughts on additional benefits or incentives that we should consider putting in the RFP, RFQ, you can recommend those to us, and we can decide whether or not those would be fit to be added. Some of the public forums, next slide. So just briefly, I don't know if you've all seen the maps. We're going to have a little inset picture here in a second, but the maps allow you to click through the zip codes to see where each individual zip code ranks on Medicaid enrollment, WIC participation, life expectancy, and low birth weight. And these were the initial screens that we created. We said that your zip code needed to be either above or below the median to be that initial screen to submit an application. And we'll see those on the next slide. And that was a draft statement. So we received statements to say maybe you should reconsider. Maybe it should be 25% of the median. Next slide. So here's a map. That is, I think, the zip code just to the east of us. Shows the life expectancy, birth weight, and actually it's clipped, so it's yellow, but it is, that zip code is this color here. It's similar to that color in Gators. Next slide. The principles, this really starts to lay out what we're looking for in an application. Each of these address all the things we've talked about. Tell us about your strategy, tell us about your partners, tell us about your sustainability. Next slide. So the Lieutenant Governor mentioned some of the incentives, income tax credits, hiring tax credits, loan repayment, priority to enter the state's patient centered medical home program, and priority for electronic health records, capital grants for capital improvements, and for other activities that you may deem necessary to implement your program. So if you realize in a rural community that you're going to establish additional primary care, but there is no transportation, you could articulate that we have a need for transportation and that is part of our application. This question has come up in other forums, the $4 million encompasses all of these credits. So when you submit an application, you're essentially saying to us, we would like $1 million and we plan on using 100,000 of that for hiring tax credits. So it's cumulative, it's included in, they are not above the $4 million. General Assembly will include that part. Next slide. So we have the website, that's all on the agenda, and I think that's it. So I'm going to have Melissa, we have another mic here. She is going to come to you with the mic, and Dr. Sharpstein and I and Uma will answer questions to the best of our ability. And